What is a healthy diet? Key facts. Consuming a healthy diet throughout the life course helps to prevent malnutrition in all its forms as well as a range of non-communicable diseases, NCDs, and conditions. People are now consuming more foods high in energy, fats, free sugars and salt/sodium, and many people do not eat enough fruit, vegetables and other dietary fiber such as whole grains. In the first 2 years of a child's life, optimal nutrition fosters healthy growth and improves cognitive development. It also reduces the risk of becoming overweight or obese and developing NCDs later in life. Advice on a healthy diet for infants and children is similar to that for adults, but the following elements are also important. Eating at least 400 grams, or 5 portions, of fruit and vegetables per day reduces the risk of NCDs and helps to ensure an adequate daily intake of dietary fiber. Reducing the amount of total fat intake to less than 30% of total energy intake helps to prevent unhealthy weight gain in the adult population. Fat intake, especially saturated fat and industrially produced trans fat intake, should be reduced. Some food manufacturers are reformulating recipes to reduce the sodium content of their products, and people should be encouraged to check nutrition labels to see how much sodium is in a product before purchasing or consuming it. Potassium can mitigate the negative effects of elevated sodium consumption on blood pressure. Intake of potassium can be increased by consuming fresh fruit and vegetables. In both adults and children, the intake of free sugars should be reduced to less than 10% of total energy intake. A reduction to less than 5% of total energy intake would provide additional health benefits. Consuming free sugars increases the risk of dental caries, tooth decay. Excess calories from foods and drinks high in free sugars also contribute to unhealthy weight gain, which can lead to overweight and obesity. Free sugars influence blood pressure and serum lipids, and suggests that a reduction in free sugars intake reduces risk factors for cardiovascular diseases. Diet is influenced by individual preferences and beliefs, cultural traditions, and geographical and environmental aspects, including climate change. A balanced and healthy diet requires the involvement of multiple sectors and stakeholders, including government, and the public and private sectors. Governments have a central role in creating a healthy food environment that enables people to adopt and maintain healthy dietary practices. The WHO Global Strategy on Diet, Physical Activity and Health was adopted in 2004 by the Health Assembly. It helped support better eating habits at global, regional and local levels. In 2010, the Health Assembly endorsed a set of recommendations on the marketing of foods and non-alcoholic beverages to children. WHO has also developed region-specific tools, such as regional nutrient profile models, that countries can use to implement marketing recommendations. In 2012, the Health Assembly adopted a comprehensive implementation plan on maternal, infant and young child nutrition and 6 global nutrition targets to be achieved by 2025, including the reduction of stunting, wasting and overweight. Thank you for watching and please subscribe.